Hi there, Ragoowansi, plastic surgeon, Harley Street. I'm fortunate enough to have today my lovely patient, Sarah, who I've known for the last 22 years. And as I've been in this particular specialty for up to 25 years, I'm fortunate enough to see patients who come back to me for various procedures throughout their lives. Sarah, I first met 22 years ago, and I did a breast augmentation on her. And I'm going to ask Sarah, how did you find me so many years ago? What made you come to me to seek a breast augmentation?
So you came recommended by the hospital that I went to, and my GP had recommended you, and I thought you were fantastic. You were very, very informative about what would happen with the surgery, about what the results would look like, and everything that I needed to know.
Thank you. Okay, so she then had the breast augmentation with me, and then obviously had the follow-up, and then I discharged her, and she had a family. Then she came to see me about 11 years ago.
Yes.
Because she felt her upper lids were a bit heavy. At that stage, what was it about the lids that made you come to me? What was it about? What were you suffering from?
It was just the fact that my top lids were starting to come over my eyelashes.
Yes.
And I just felt like it made my face look very cross a lot of the time and tired.
Yes.
And I said to you, is there anything I could do? And you'd recommended the upper lid surgery.
Yes, yes.
And I took your word for it, as I always do, and you were very right.
She then had the upper lid blepharoplasty under local anesthetic. It's 60 to 90 minute surgery with a 4 to 6 week recovery period. And then she was fine after that. Then, a couple of years ago, she then reached the time where the implants had to be exchanged. Because I put the implants in 21 years ago, and those implants last for about 15 to 17 years. She came to see me then, so we then did a consultation, and essentially the implants were ready to come out. But at the same time, with time, the nipples had gone slightly southwards, and the skin had gone lax, and she was keen to have an uplift. So I then carried out, about 18 months ago, exchange of implants and an uplift. How do you feel about all of that?
It all went really, really well. I was very, very pleased with the results. I think it was slightly more painful, than the first operation, because there was a lot more involved.
Yes.
And perhaps the recovery time was a bit longer, but I was absolutely over the moon. They look fabulous. They feel great now. And yeah, very, very happy.
That's very interesting, because when I exchange implants, I try and create a different pocket. So in Sarah's case, I had to go one pocket deeper, partly under the muscle, because she's thin. I didn't want the implants to show. So I went one pocket deeper, and in raising the muscle, that does cause a bit of soreness, which obviously you experienced.
Yeah.
She's recovered from that, and she's happy with that. And now she's come to me today for a lower lid blepharoplasty.
Absolutely.
Tell us about that.
So I've just noticed that over the last sort of year or so, my eyes have become quite puffy underneath and just at the sides here. And I'm noticing it more, and the skin's becoming a little bit more wrinkled. So yeah, before it gets too bad, I would like to have that done and to tighten it all up.
Sure. So again, I've examined her, I've assessed her. She's a good candidate for a lower lid blepharoplasty, which essentially is a couple of hours procedure under general anesthetic. The scar is just under the eyelashes. The skin is raised. The muscle is trimmed or just redraped. And then the fat pockets also taken care of. The skin is then taken away, and the scars closed with non-dissolving sutures. In terms of recovery, she's a teacher. So I've said that at about 2 to 3 weeks, she can go back to school. She'll have a little bit of a hue or a little bit of bruising at that stage. But at 4 to 6 weeks, she'll look absolutely normal. And the scar itself is just under the eyelashes. It takes about 3 months to fully settle. Thank you, Sarah.
Thank you.